Hello, everyone. The Next Generational Leaders program and the Tayores Network at Engage University welcome to you to the discussion on health, equity, and accessibility in the 2022 Global Public Deliberation. So let's start with the presentation. The next slide, please. Health is fundamental in our lives and affects us all in some way. We can see it in the community continuing increase in healthcare costs, increasing inequalities, leaving population vulnerable, and impoverishing them even more. So let's slide, please. Health is important in our lives, and this guide has been redesigned to help discuss together how we can approach providing accessible and affordable healthcare, taking into account our context and realities, how these issues as affect our families, friends, and community before, during, and after a pandemic. So is we create a single government program to pay for everyone's health care, would taxes, right, and quality surfers. The next slide, please. I welcome my
Yes, this brings us to the big question. How can we achieve accessible and affordable healthcare? Response to health system crisis, especially is worrisome in developing countries in the global south where public health care systems are severely constrained due to low quality provision of critical medicine and insufficient infrastructure. So if we create a single government program to pay for everyone's health care, would taxes rise and quality suffer? Or should we take responsibility for our own choices in a more transparent and competitive marketplace, even if that means those who make poor decisions will suffer the consequences? Improving our healthcare systems routinely presents choices between holding the line on enormous costs, covering more people, and maintaining choices and quality of care. Which should we then take as our priority? Next slide, please.
So here we can handle key consideration. There are several policy solutions in place to increase the quality and access to healthcare, should add outsourcing critical healthcare service and subsidizing the private sector to provide health care to the population. Universal health coverage is about ensuring that people have access to the healthcare they need without suffering financial hardship. It is the key to ending extreme poverty and increasing equity and shared prosperity. The next, please. To have an environment of respect, these are the rules to carry out the forum. So focus on the option and actions we can take nationally and in our communities. Consider all options fairly. Listening is just as important as speaking. No one or two individuals should dominate. Maintain an open and respectful atmosphere. Everyone is encouraged to participate. Feel free and confident to raise your hand to participate or share in the chat. I welcome my colleagues to introduce option one, ensure healthcare for all. Next, please.
Good morning, afternoon, evening, everyone. So to kickstart our thought processes for our deliberation today, we're going to jump into option one. So the key idea is to ensure healthcare for all. This option says that healthcare is a basic human right, and the fairest way to ensure its fulfillment is to create a government health insurance program. The coverage ensures health coverage regardless of job, income, or medical history. So such as the NHI proposed in South Africa, the NHS in the UK, and potential universal healthcare in other parts of the world. This eliminates competition while allowing every citizen to access healthcare on a free basis. This option says that a single government insurance program would be more cost-effective, easier to navigate, and fairer to all. So this is option one to think about while we move on to the next one.
So as we consider option one, there'll be a few questions that probably pop up into your mind. Because this option gives the government more responsibility to come up with a healthcare system that works for everyone, a question you might ask to yourself is, do you think that government would do a better job than private insurers do now? And if yes, why? And if no, why not? We currently have, or most countries currently have, a system that is endorsed by the government, and then there's also a private system at work. In this option suggests that there should be just one system, and that is assigned to the government. This also might make you think that what about the jobs that the destruction of the insurance industry would face the consequence of? Two other questions you probably ask yourself is, or maybe there are other unintended consequences, whether or not that is worth worrying about. And finally, is this the most effective option for specialized care? These are just a few of the questions that you can consider as you consider option one.
Yes, as we look into option two, we have decided to say that we let people make their own choices. Now, this option says the most important way to improve our health system is to bring prices down. And the best way to do that is to give citizens responsibility in making their own choices about their health. And no one should pay for the coverage they don't want or they think they might not need. Well, this option says that making prices publicly available and easily understandable will bring down costs by allowing healthcare and consumers to make their own choices, thus driving prices down. As we discuss this option and try to understand this option, we should understand that there are drawbacks and sub-downs of this option as well. But let my colleague first lead you through the next the questions that we have for discussion on this option. Next slide.
Thanks so much, Petrovis. And so from that option, some questions that we might want to consider today is, well, first of all, how realistic is it to expect people to shop around for insurance plans? Do people have the skills or the knowledge or the understanding to be able to do this effectively or efficiently in their own countries? Are most insurers clear about what they will cover and what should happen if they don't? And how do we work together to solve issues of if they aren't happening or if they aren't going to cover something? As I said, do people have the knowledge to choose wisely amongst doctors or hospitals? And is it fair to ask people who are facing life-threatening conditions or lifelong conditions to actually make these choices and to shop around? Like the idea of contraceptives in the case of Cameroon. I suppose this option argues that people who don't need many healthcare services shouldn't have to pay for them. But experts say that this will costs will rise for older and sicker people if healthier people aren't in the pool. So is it fair to require healthy people to buy coverage for something that they may not need? And so those are some questions that we may consider for option two. But whilst we've outlined questions for option one and option two, these aren't questions that you have to be limited by. So any questions that you might think about in relation to these options are also fair to be brought up, discussed, and debated amongst the groups that you will be in. So to kind of give you some information about, well, what's going to happen for the next 40 minutes or so, with the moderating team of which you've met throughout this presentation, you're going to be randomly assigned into one of two breakout rooms, with either option one, which will be Mark or Faiza, or option two moderator, which is myself and Petrovis. You'll then begin your discussion on one of the two topics, the two options. After 20 minutes, though, unfortunately, we're limited by time a little bit, so we're going to have hopefully very robust conversations in a short amount of time. But after 20 minutes, the moderators will switch from the breakout room that they're currently in into the other breakout room so that both groups will get to discuss both options. Again, then you'll have 20 minutes for this discussion, maybe a little bit longer, depending on how much time we have for both discussions. But after this, we're going to come back then as one wider group and do some, I suppose, some feedback, some discussion, some things that maybe came up. Maybe there's a third option that people have decided to actually be better. Maybe it's a combination of both, or maybe we have really strong views that option one or option two should be the way forward. So hopefully we'll have a really nice discussion over the course of the next 40 minutes on health equity from perspective of your own country and your own communities. And if you do have any questions, please do raise your hand, put it into the chat or unmute yourself, and you can ask one of the moderators to help you out with that. So I'm going to hand you back over to Carla for the last slide, and then Christina and the folks at Towers are going to help us to put you into some breakout rooms for the next little while. I'm not sure if Carla can hear us, but if she can, maybe she can jump in. If not, we just wanted to thank the folks that were involved in, I suppose, organizing this event as well, with the support of the Towers Network, but also a number of students and young people who were involved in delivering and designing this content that you've read today, the outreach team who've hopefully done a really good job of letting you know this event was happening, and to my fellow moderators for taking on the task of moderating this session today. So thank you all for your help, and I know some of you have joined the call, and Laurleen and Christina, and so for your guidance as well. We really appreciate it from the Towers and network. So Christina, I don't know if you have the breakout rooms ready. I don't want to rush you because I know I'm not very good at the technical side of the house either. But if they are ready, we can possibly move people in.
Thank you very much, everyone who was joined this breakout room. As our main option one is that everyone should make their own choices. That is the option we're going to be discussing here. Now, the possible questions that my colleague has really brought forward is, how realistic is it that we expect people to shop around for insurance plans? So Cameroon, let me welcome you on board as we drive and begin the discussion.
Thank you. And I suppose from the issue guide that was issued to yourselves, hopefully you've become familiar somewhat with health equity and I suppose the basis of the discussion from today. But some of the things that we ask you to, I suppose, look at in the initial stages based off of those slides and conversations that we had around health equity and around how we achieve accessible and equitable healthcare in terms of tackling, rising costs, tackling pandemics, tackling access to care or lack of access to care across our different nations and different countries, and what that may entail for some people or what that may not entail for some people. We ask you maybe to reflect upon how this issue may affect yourself, your family, your friends, your community, or any, I suppose, insights you have to health equity from your own perspective that you may wish to share at the beginning stages of this from your own, as I said, from your own perspective, or something that you might have seen in your community. As we recognize, lots of different countries are represented. So what's available in Ireland, where I'm from, it may not be available in Uganda or in other parts of the world where other people are from.
I will break the ice, I think.
Thanks,
Hi,
John.
guys. Good to see you all. A couple of familiar faces and new faces. Yeah, in my country, it's mostly government controlled with a mix of some private small clinics. And I'm not very agreeing with the sentence that everyone should have an opportunity to shop around, or in a way it's a right for everyone to shop around, but at the same time you might be trapped with a marketing of this private sector that is, big corporations are taking over the smaller ones, and usually, and then together they're or joining, sort of making a mafia sort of like alliance, and then rising the prices for access for healthcare. So at the end of the day, whether this kind of system will be a cheaper option or most available option for everyone, which I don't think it's a good option, because uh, sort of, as we said, there are a lot of cases when there's a threat to life, and then it's getting get very expensive. So that's my opinion. If someone wants to rebuttal it, or
Thanks so much, John. Any other insights from, and it may not, maybe we won't use health equity, maybe sometimes that can be a little bit inaccessible for people, but from the healthcare systems or I suppose infrastructures you might have in your country, do you have any initial thoughts based maybe off of what John said, or some of the introduction to what healthcare should or shouldn't be? And feel free to put it into the chat as well, if you would prefer to type as opposed to verbalize or to vocalize. But John, something you said there actually struck me around, I suppose, that idea of competition. I suppose like this option does center a little bit around, well, I could charge you €10 for something that someone else is charging €20 for, and is that any better? So maybe had you any thoughts about, well, how do we create a system where we can, vet different groups that might be offering healthcare as this is actually approved, or this is actually reliable, or this is actually something that will help? Had you any thoughts on that, or was it more kind of, if the prices are kind of competition wise, we probably shouldn't go with it?
yeah, that's very complicated question, I think. How at the end of the day, as you said, like, what's the system like right now in Ireland? Is it government provided?
In Ireland, it's a mix. So we have a government provided healthcare where some people will pay. So it's based off of your income. If your income is below a certain threshold, you get what's called a medical card. And then I'd say like 99% of medical care is free, like pills, prescriptions, surgery, stays in hospital. If your income is above a certain threshold, which doesn't take into account a lot for people, then you have to pay out of pocket for lots of things. Lots of folks will then have insurance, like private insurance, but the private insurance market just drives up, I suppose, demand in other parts of the healthcare system. So it's a bit of both. But a lot of healthcare is also outsourced from Ireland, where people will travel across Europe for different types of life-saving surgeries or different techniques that aren't available, because we're quite a small country. So we kind of have lots of different small systems going, and none of them are quite perfect.
Yes, thank you very much, John and Cameron. Well, allow me also interject and emphasize that the issue also puts much more emphasis that the prices will be made public, such that people are aware of the prices of medical care. Yes. So I don't know how that would do in your different countries. But then since we are not getting much of the view from that, then allow me take you guys straight to question number one, as we try to reflect on this in our different countries. Question one, which says exactly that: how realistic is it that we expect people to shop around for insurance plans? Are most insurance clear about what they will cover? So do we think people really know more about what this insurance will cover? And how do we expect them to shop around for this? Let me hear from the ground. What your thoughts are on this? Thank you.
Okay,
Yes,
so
I can. Yeah, sure. You
I
can
was
go
going to
on.
say the
Camille.
same thing, but go for it, Petrovis.
All right. I'm seeing something in the chat. That is Tonel saying in the US, many healthcare programs are tied to people's jobs at companies, which proves to be problematic. Also, the insurance market is very confusing. Yeah, that is interesting. That is very interesting. When it gets that much in, pardon? Yes, you can come on.
I was just going to say, what do you think would make the insurance market less confusing? If option 2 was all we could go with for health equity across the globe, what makes insurance confusing that we could tackle to make it less confusing?
I can vocalize. I just was putting some thoughts into the chat, but I think it could be made less confusing if there were clear definitions of terms that are sort of just thrown around. I think, you know, in the US at least, we never got lessons in school about how to select insurance plans. I have insurance through my job, and I'm still not sure exactly what is a deductible, how much, what are contributions, what do I pay versus what the insurance company pays. And I think a lot of the times that that lack of clarity ends up hurting the individual. You know, when you're at, let's say, a medical emergency and you're just like, do what you have to do, and then at the end you're faced with the huge bill because you didn't realize just the limitations of your plan. So I just think maybe more clarity in terms of definitions and like the systems. You know, it's a very opaque system right now.
Yeah, I think that's very clear, and I think it matches quite nicely to Haruna's point, and that he's put into the chat, that in Uganda, insurance is quite a new form of business, and insurance companies aren't so open with answering people's questions, which I think is something related to what you were discussing there, Caitlin, in terms of lack of clarity, lack of openness, lack of understanding. And then how do we encourage people from underserved regions like Uganda to buy the idea? Which I think is a really good point. Haruna, how do we encourage people to look at the idea? And is it fair to have to encourage people from maybe underrepresented groups who have less accessibility to insurance or less accessibility to understanding different types of insurance or different plans? Is it fair to expect folks from those areas to have to do that? Or is there a better system that we can employ?
Wow, thank you so much. Wow, that is great. That is amazing. And now that brings us down to, if we are to encourage people to pay for what they will not cover, or to pay to adopt the program of insurance, it takes me down to the second question: that do people really have the knowledge to choose among doctors or hospitals? Or the best question would be, do people really have to pay for the covers they think they would not want or they would not use? What do you think about that in your perspectives? Someone taking up a cover that they think probably in the future they might not use it, and they feel like they might be wasting their money. How do we encourage such people to know it's important? Yes, I see in group color says in Mexico you have the option of private health with costs that are not necessarily to the most vulnerable communities. But even so, there is the idea that it's better than public health. People prefer to pay for what they believe is more reliable. Wow. That is interesting. Yes, then okay, that's great. Well, what do the rest of the people think about this? Should you pay for what you will not cover? And also, leaving that aside, we know that sickness comes and we are not ready for it. At times, you might think you don't need this and then you need it. So how do we curb people from these indifferences? Yes, John, come on. Thank you.
Yeah, I think that you're right in that case. That when you have this Medicare for all or like health insurance for all that is directed from one source, I think it will be much easier to coordinate, and it will be cheaper, equally for everyone, because you know, when it's public, you pay from your tax. Especially many European countries actually are very advanced on this. Everyone puts in one pot, and then you never know what's going to happen to you. As we have seen throughout COVID, that there's a high uncertainty in regards to your. It doesn't matter you are old, young. It hits you together. I mean, it was equally. So you're not never sure. So then I think it would be better for everyone to pay, so that then it's just giving back, saying when you are young you pay, and then when you are old maybe you pay less, but then it comes back to you, so that then it
Wow.
will be cheaper. It will not, cheaper. It will be cheaper for older people and then also minority people to have access to healthcare.
So you think that overall the idea of if I'm healthy, then I don't need to pay for things, for health insurance or health equity, then I shouldn't pay. But if I'm not healthy, then I should pay, is kind of not a great starting point, because maybe you do develop a sickness at some point in your life and you do need the insurance and you haven't paid at a certain point. So you think that it would be a much fairer system for everyone to pay similar amounts, and then that decreases with age or decreases with, certain populations or whatever it might be, that it would be easier for everyone to pay into one system as opposed to a self-selection of, if I don't have any illness, then why am I paying this? Is that correct?
No, actually, you have to certainly pay equally, but then I think there should be some incentive and discount for elderly people who are in a pension, because they are not at work anymore.
Okay, and then just on Carla's point there, in terms of people prefer to pay for what they believe is more reliable than public health, or what they believe to be more reliable in general, how do we create a system then of transparency and accountability within healthcare, whether it's public, private, or insurance? How do we create that system where you have to be transparent about what you're offering, where your money is going, what coverage will be there?
Thank you, everyone. I think I can come in. Thank you, Cameron and the team. I think I can contribute to that based on what I see around here. I'm in Kenya, Nairobi specifically, in town here. And what actually I'm seeing for me as a young person is that actually what you're mentioning about accountability, that has been a big problem for the systems here. There's actually a public system of the National Insurance Fund, which actually it is catering for the public servants, and of course anyone, even a private, provided you do monthly contributions. However, it happened that sometimes people fail, even if you have subscribed up to date, that those who don't get services that they expected because of course, accountability issues. When of course they are for example, the whole system or that particular organ comes out and talks about that as much as we had intended that we shall cover this and that, because of the nature of the diseases that we are seeing, I think we are not able to. and particularly goes maybe to chronic diseases, and of course in the current dispensation, especially, and I'm happy that COVID is here, just it's in the 2019, 2020 running across the globe. This has been a lesson in Kenya, where I told about that whichever insurance you had, whether it was public or private, they said that they don't cover COVID-19. And that actually has been now open, and it is actually showing that there are lots of loopholes and of course gaps in talking about insurance in medical services. I think I'm not so sure about other countries, but I think particularly for Kenya, that is actually registered as a loophole. And of course, this one points out the fact that as much as I'm getting insurance, the insurance does not cover maybe global pandemics. We don't know after COVID, of course, this is God forbid, we don't know any other coming. It means even if I have paid up for COVID, for example, there are those who have introduced coverage for COVID that you pay up. And assuming that I have paid up even for COVID and a new pandemic comes, apparently it means that still a lot to be covered. That means that talking even about the insurance in the medical scheme, I think it's still something that is debatable across across Kenya in particular. I think that's what I can say for now.
Well, thank you so much, Patrick. That is a nice, good suggestion there, and a good point you've made in. Well, I didn't want to miss this point exactly, where saying we have 2 minutes left. I didn't want to miss the point where you're saying if we pay for this, maybe we don't use it. But now I want to bring it to the attention of the room that there are people, when you're facing life-threatening situations, you know that you don't have the time to rush around and look for an hospital. And if you add the insurance by that time, that is what would save you. So will we be able to cover such situations, such problems, if we do not go for insurance, or if we have to pay for it ourselves? How will we handle when we are sick and we don't have the time to run around to look for doctors? And also, I love one of the points that Danielle put in group. She was talking about it bringing up an issue of inequality, where Carla was saying that everyone is privileged to have I mean, not everyone is privileged to be able to afford the insurances. And then she adds on saying the government had a program that's in Mexico, that the government had a program called Popular Insurance, which provided more health expenses, but the hospitals did not have enough medicines to give people. So they brought medicines, and these were not covered by government since they were from the private organization. It was a hoax. Wow. Okay. Aruna says that the option of having insurance is a monopoly of the government, which will encourage corruption, and accountability will be difficult to achieve. Many private firms who cannot do it better, but competition will.
Hello.
Hi guys.
Hello, hello. Wait for Mark, our other moderator, to join. But until then, John, can you confirm that we discussed option 1 in this group so far, and we need to discuss option 2? Thank you, John.
So yeah, in the first session we discussed with this group option 1. The question was, how realistic is it to expect people to shop around for insurance plans? Now we switch to option 2.
Okay. So on the presentation, that's option 1, right?
Yes, if I'm not mistaken.
Yes.
You
yes. Mark, can you share your screen?
Okay.
Yeah.
Can you see? Okay. me 2 seconds. I'm gonna stop sharing, and then I'm gonna start sharing again.
All right.
Okay. Oops. This is awkward. Okay, give me 2 seconds.
Technical difficulties. 1 second, please.
Sorry. Cool. Apologies. So we're working with option 2. Okay. All right, give me a few seconds. 3, 2, 1.
I can start the conversation. Oh, all right.
Yes, please. Okay. Not everyone will see my personal messages, but welcome. Cool. Great. Please take us away, Faisal.
Yeah. Is this the option you guys discussed? I think this, Mark, they already discussed this. We should go back to option 1.
Back to option 1. Okay, cool. Amazing. All right. Cool.
So to remind everybody, one was to ensure for all, and this option says that healthcare is a basic human right, and the fairest way to ensure its fulfillment is to hand that responsibility to the government to come up with a health insurance program that covers everyone in the country regardless of their job, income, or medical history. This option says that it will eliminate competition between different programs among citizens as they are trying to access high quality healthcare. This often a single government insurance program should be more cost effective, easier to navigate, and fairer to all. So that is what the option says. Let's start the discussion with about personal experience and how that influences your perspective on this option. Does anyone want to start us off? John says this is one of the best ways to organize healthcare system. John, I would love to invite you to unmute yourself and elaborate.
Yeah, I think because I was I was sort of cheering for this idea in the previous option because I mean, not, of course, not all governments can do that. There's a lot of corruption involved, but like once you solve this problem, I think government could provide all the necessary, or at least, subsidize or outsource basic, like maybe specialized health incidents such as surgeries, and maybe they could outsource it for small clinics. But they could be, at the end of the day, they could be in charge of, regulating and the prices and the access for all. Yeah, Caitlin the corruption. Yeah, corruption is the issue. But I think that's the one way. That's the tricky part, that people should hold the government accountable, and maybe to make them more transparent.
I thank you, John. I'd like to invite Caitlin to unmute and talk about why that is a concern for them and maybe a possible solution on how we can have option 1 be implemented and still be a success.
Thank you. I don't have any solutions. I feel like I just put that comment in there to express a concern. I think there would have to be an adjustment in maybe incentives for the service providers and for government bodies who would manage all of this. And I think there would just need to be a lot of oversight, maybe, from non-governmental organizations, watchdogs, the international community, citizens. And I think that's what's needed. But I think right now, as we stand, governments can be so oppressive, so that accountability piece isn't always possible.
So some possible recommendations, Caitlin, that I heard from your answer is having the international other non-government organizations hold them accountable, which is an
I think we might be
yourself.
losing you a bit.
Oh, can you hear me better now?
Yeah, yep.
Okay, thank you so much for flagging that. Patrick, do you want to unmute yourself and elaborate on your point in chat?
Yeah, sure. Thank you. Yeah, of course, as you mentioned about this, someone mentioned something about corruption, and I think I was just adding up something on that, talking about actually the whole issue about accountability. That I have the experience here. I think for me, I have a young daughter who's in hospital recently. Apparently, just malaria that would be contained with outpatient services, but the facility demands that they must be put inpatient and even extend the number of days that they will stay at the facility, so that when they go out there to claim for their payment, they get more money. Of course, now see that becomes dishonesty playing in the mix and the whole system. These are things actually becomes quite unfair, and I think these are some of the things that actually makes inequities in health services or care. I'm being told, I think from reliable sources, that there are companies, insurance companies, that have realized that such happens. And for them to avoid now this over withdrawal or over payment to the health facilities, they also now become adamant to sometimes even to pay some joining payments, or even if it is a small amount, they think that that is not actually sufficient. There is not sufficient reason for the payout, despite the services being offered. So that has become a very big problem here where I am, because I'm truly in Kenya. And I think this is some of the things that are actually making the whole system, I think, malfunction. Specifically, and I'm speaking specifically about Kenya, which I'm experiencing, that when we offer services that you can pay for insurance, if someone becomes ill or is hurt or something, then someone takes that advantage that because we have signed up a contract to pay, then they want now to get more that is actually not supposed to be paid. And necessarily it becomes quite unfair, and now the whole system malfunctions. Even going back to the government side, of course, I think there's now corruption. It happens now the corruption side becomes that if it's a public entity, the government insurance fund, we call it here NHIF, you find out that now there are even some who are colluding. There's some staff at the ministry colludes with the health services providers on how they loot and even make fake forms to claim for payment that are not there. Of course, at the end of the day, sharing the loot, which is quite unfortunate. Thank you.
Thank you, Patrick. So Patrick brought up the point of accountability beyond the government. We also have health insurance companies and healthcare providers, sadly, taking advantage of vulnerable people and patients, and not taking care of them as they're on chat. Says shares a personal story about his relative who was in the hospital and failed to break the news immediately and kept lying that the patient will be okay. They kept the body attached to an oxygen mask. All this was done in spirit of charging exorbitant amounts. Now, if we have this insurance, will the situation be allowed? Thank you so much, Karuna, and I'm really sorry for what happened to your relative. But this point of accountability as a beyond holding them accountable and also holding these private sectors and healthcare providers just as high to a higher standard is interesting. Does anyone have any thoughts on that? Mark, can we switch to the second slide with the questions? Are there any other consequences of government-issued healthcare that we should be concerned about or discuss, consider, or implement option 1 in your country?
I can just say that
we have. Go ahead, Kit.
I know that this is a drawback that people in the US, when we push for public health care, the drawback is that the argument against it is that the government then can decide on your healthcare. Basically, like, you need approval from a governmental body for a treatment, and in the US, that's, you know, we're not about government oversight, and you know, so that's an argument that the government can have too much of a role in your healthcare journey.
And the concern there is that if we already don't trust the government, how can we trust them to make our healthcare choices, right? Yep. John says on chat, and were you going to say something? Okay, I guess not. John says, I think there's also a scenario that government can cut back on budget. John brings up another great point, is that the services that have in it for us in most countries comes from the taxes that citizens pay, and those taxes are allocated in different parts of the government's role, and they could decide to cut back on healthcare budget, for example. Then how does that affect the rest of the country and the citizens in the country? Very interesting point. John, would you like to elaborate?
No, I was just thinking, I mean, there have been multiple cases when the government cuts back the tax or decreases the certain help that population needs, especially elderly. As we were talking about, like, specialized, you know, care or special circumstances when you need certain surgery or transplant, like organ transplant, and then the government really lacks in that sort of terms. That, for instance, it was an issue that was a kidney transplant because it was controlled by the private sector, and government couldn't really afford to bring it on time. And this kind of case has been, I mean, there are a lot of this kind of cases. So that can be one of the drawbacks of relying solely on the government.
So it seems like the group is heading towards this path of can we just trust the government solely for healthcare, for creating an effective healthcare system? What other options do you guys can you guys think of? I see a hand is up. I think your name is Tariq.
Yes. Hi.
Yes,
thanks so much for organizing this conversation. I was curious about the issue of democracy, because it seems to me that this kind of conversation is this kind of dichotomy. It sounds dichotomous for me, which it should not, because for me, I think we need to have some kind of course, this is an inalienable right that every citizen should or every resident should have. And I think sometimes when maybe I don't have well-formulated question, sorry, but I think the question of democracy here comes back and forth to me. So I have a question actually for you who wrote the questions about when you expected answers for these questions. Who should answer these questions in your opinion? Experts or government officials or legislators or underprivileged communities? Who exactly you intend to ask these questions and should respond to this question? Thanks.
The point of this deliberation is because we believe that people from different backgrounds, opinions can have a productive discussion. So I would actually like to extend that session to everyone else in this room. Who do we think should make these decisions and why?
I think that's a good question. But as we said, since most of us trying to live in a democracy, I think everyone should have a voice to answer and ask this kind of questions. It should not, of course, it should rely on experts in the field, but at the same time, if I'm a patient, I have to have sort of a voice to, to declare and then choose my options of healthcare and having access to healthcare or having a right to healthcare. So that I wouldn't really rely only on specific type of groups to make this decision. So, and then that's why it's up to deliberation among this population and your community where you are having this kind of discussions.
Thank you, John. Since we have someone on chat says, I think this is a conversation for all to have, the government as well as citizens who can keep their leaders accountable. All right, there's only 1 minute left. I'd like to summarize the wonderful brought up by everyone here. We ultimately conclude that it seems like the group concluded that it should be a conversation for everyone, and there are concerns about trusting the government as well as concerns about trusting healthcare providers and private insurance companies, and we will have no one answer. We do have a lot more questions and takeaways from the discussion. And yes, I think we will be moved back to our room. Is there any other parting thought before we jump back from anybody? Oh, we have 60 seconds. All right. Thank you, Caitlin. Thank you, everyone. See you in the main room.
Thank you all.
Individuals are dominating. We will also, thank you. We'll also make sure we're respectful and we encourage everyone to participate. So yes, those are the ground rules. All right. Mark, can you let us know when?
Will do. I'm currently trying to figure it out. But
Okay.
I think what
right.
I do that let's maybe begin the discussion on the concept of so like pretty much universal healthcare in essence is what the first option speaks about. So maybe we can just initiate ideas on the thought process of that and then jump into the questions while I figure this out.
All right.
Thank you.
Okay, so everybody will have visuals soon, but I will read out the first option one more time to refresh everyone's memory. So the overall question is, how can we achieve accessible and affordable healthcare? And the option we're going to be discussing in the next 20 minutes is ensure healthcare for all, This option says that healthcare is a basic human right, and the fairest way to ensure its fulfillment is to create a government health insurance program. The coverage ensures that health covers everybody regardless of their job, income, or medical history. All right, I see that we're having some sharing here. Mark, we can't see the slides yet, but we can see your screen.
Can you see the
Yes. All right.
slides now?
Yes, we can.
Amazing.
Is there any can we zoom in by any chance? So we're okay, it's okay. No, I think it's all right. No worries.
Sorry.
Okay, so when we have a government health care plan, this eliminates, the idea is to eliminate competition and giving every citizen access to healthcare on a free, quote unquote, basis. This option says that a single government insurance program would be more cost effective, easier to navigate, and fairer to all. So let's kick off the discussion with a general question of what are your initial thoughts? It'd be great if you can jump in as you have something to say, and if required, we can come up with a system in case we want more people to speak. So the first question is, what are your initial thoughts? Mark, can we go back to option one?
Apologies. Sorry, guys.
All right.
Okay, I'm trying to.
Yes. I'm going to, okay, if I can start calling on a few people, if it's easier for everyone to share their thoughts away.
Perhaps, Faisal, what we can do is ask a question, just like more like, do we believe that this is a good option? Do we believe this is the option to go with? By all means, like Faisal said, unmute yourself and give a yes or no, and then let that be the point of departure for the discussion. So, do you guys believe that this is the number one option that we should like? Let's say government officials, lawmakers, this is the option in front of you. Would you do it, yes or no? And then we can elaborate on that.
Yeah, feel free to share your personal experiences with the healthcare system in your specific regions and parts of the world. How about we kick it off? Okay, I see that someone unmuted themselves. Maria?
Yeah. Hi, everyone. I'm from Mexico, and I would like to share that in my country, there's like a between of both of them. We have a government healthcare, but also we have like a private health system. Therefore, some people that can afford to go to the private healthcare can go to the community or public health system, which I believe that has some like deficiencies, but the people like say that I have to suck it up because I can afford like the private one. So that I believe that this is the best option because there's like more fair to everyone. So yes, I will go to the option one.
Amazing.
So what I'm understanding, Maria, is that in your country, there's the private sector and also a government issued health insurance, and this system would be preferred by you to make it fair.
Yeah, but if I have to pick one, I would rather be picking the option one.
Okay, thank you.
Thank you.
Amazing.
We have two people raising their hands, Mark. Do you want to pick one?
I can't see, so please go ahead.
Okay, I can start with, I think, You can continue. Who unmuted themselves? I can't see everybody.
Okay, that's fine. Thank you, everyone. So I am from Namibia, and just like the previous speaker described her country, Namibia also has a mixed has two mixed systems where there is the public and the private aspect of healthcare provision. And honestly, I think just like her, I totally relate to what she's saying. If we want to provide healthcare that is, fair and everybody, regardless of economic status, I think I would advocate for option one. Currently in my country, the state system sometimes is not fully or well equipped in terms of not just commodities like medicines and equipment, but even in terms of human resources. So we find that people who are on the lower level of the economic status do kind of get, I don't want to call it substandard, but maybe it is. I should just call it what it is. It is substandard because then they don't have access to some of maybe the drugs or even tests that they need to have. But I think if option one is implemented, where the state is funded, the rich, the poor, everybody have access to the same care, I think that would be fair for everyone.
All right. So from what I'm understanding is you're saying that having one system will ensure that everyone is getting high quality healthcare, regardless of the background and what they can afford.
Absolutely, absolutely. And I think also one more thing I forgot to add, Namibia is a very sparsely populated country. It is a huge country, but sparsely populated, meaning that also people usually have to travel long distances to access healthcare. So that even is made worse when there are no services provided by the state, because we know that at least public health service, healthcare service is accessible, like more accessible in remote places. We hardly have private doctors in like villages or the more remote places. So that becomes very difficult for people who are living in less civilized geographic locations to access the care that they need. So for that, I am advocating for option one.
Understood. Mark, maybe we move to the second slide of questions to consider. As Bakile, you can continue, you can unmute yourself and share your thoughts.
Yeah, sure. Thank you very much, Faiza and Mark. Incredible. I think I do understand what the previous speakers have shared. I think I'm a bit conflicted on whether it's a yes or a no kind of answer, because I understand, for example, in the South African context where the NHI is being introduced, and I think the big debate is whether people do trust the government to have the ability to implement such a project. I mean, already in South Africa, we're struggling with things like load shedding, corruption, this and that, where the government has continuously proven to be not capable of managing resources to some extent, where resources are mismanaged. So it becomes a kind of an uncomfortable discussion when people are like, should we give our money to the government and hope that they're going to take care of our healthcare when we hardly do even have electricity? We have electricity very periodically. So I think from just a trust perspective, I'm not sure if even with the current debates in South Africa, folks are just, everyone is a bit uncomfortable whether we're willing to trust the government or not. But also I'm thinking health is a very personal issue. And at the same time, universal health coverage is very ideal, and it's what I think we all want. But at the same time, is it very accessible? And I'm just trying to use other countries like the UK, as you've made an example of the NHS in the UK. For example, there's long waiting lines normally for specialized medical interventions. compared to other countries like the US, where it could be like a straightforward. You get any injury, you can get an operation almost, 2 weeks time or 3 weeks time. So and it kind of like becomes like a market and a commodity where it's kind of like you pay and you get it. So I'm still conflicted between the two, really, to say which is which, because I think there are trade-offs, really.
Mm-hmm. So Vakile brought up a very interesting point of how in some countries there's no trust in the government to do what they have been trusted to do, and giving the government responsibility for healthcare might be a cause for concern. I have one response on chat from Maria. Maria, would you like to unmute yourself and state your point?
Yeah, of course. Thank you. I think you're absolutely right about it, because I was thinking in an utopic idea where the government isn't corrupt and where all the people can trust them to reach the health to everyone, right? But yeah, also in my country, there's a feeling where if we pay more taxes in case that everyone can have a health system, they really won't pay for those things that the people that really needs help, that really needs their medications and that, they will really not be able to get those medicines because the government will steal the money. Yeah, you're right about that. But even though I believe that the health or the right of having the capacity to reach out for help is that universal, how do you say, right? Yeah, right. So
you agree that it should be a universal right, but you understand the concern Vakile has with entrusting the government with that responsibility.
Yeah.
Okay, I understand. I think this is Mercy who said on the chat that she would like to go next. You can unmute yourself, Mercy.
Yeah, thank you, Faiza. I'm calling in from Cameroon. And on this option, I don't think letting the government take whole charge of the health system is going to work in my country. Firstly, there is no system put in place that can follow up if the government is completely controlling and paying for everyone's bill. Now, people want to pick between government and private. It's true, government will be cheaper. But what is it that you're going to get from the government? There'll be a lot of carelessness because no one is there to follow up. But in the private sector, there is a lot of follow-up such that you cannot do what you like. For example, I have this case that happened recently to a relative of mine. She went to the government hospital because it was cheaper for an operation. And during the process, anesthesia was given to her in the wrong spot. And today she has a problem with her spine. The same doctors tell her that if they operate it, it's a 50-50 chance. She can go paralyzed completely and she can be healed. So she was following cheap cost because it's a government hospital. But at the end of the day, she is suffering now. So I don't think that government is doing it. And now there is no system put in place such that the doctor who did that crime is punished for that in my country. In other places, maybe a doctor like that could be handled. But so I don't think, to me, option one is no. There should be private, there should be public. If you have your means, you make a choice and go where you want to go. Thank you.
Thank you, Mercy. So Mercy brings up a point about how the current government-issued system is not working. So how can we entrust them completely? And Mercy advocates for having them both be separate. I see that Joseph's hand is up. Joseph, you may go.
I am Joseph Oloba from Uganda. Well, for my case, yes. So I think for now, especially in less developed countries like Uganda, this scheme may not work well because in Uganda, just in 2021, they passed the National Health Insurance Scheme, and according to the scheme, people are supposed to subscribe, and the suggestion is that every employee, whether working with government or a private entity, should contribute 4% of their monthly salary to the scheme, and then the employer adds 1%. Now, if you are self-employed, you are expected to pay 100,000 Uganda shillings every year. We have already had private insurance schemes trying to do that. Actually, companies trying to do this, but for most people, actually, they can't afford. So it only means that it's very difficult for someone to accept 4% of their salary to be deducted every month, given the fact that they already receive very little pay. And for most Ugandans, they actually can't get this money to contribute to the scheme. So it means that the government or these other governments in less developed countries need to first address the issue of poverty so much to make sure that at least everybody in the country can earn some good money so that they are able to contribute to the scheme. Otherwise, it's going to be difficult before even we talk about issues of corruption, embezzlement, and so forth. So affordability is an issue since people are poor. Yeah.
Joseph brings us to the end of discussion of option 1 with a point about how health insurance that is aligned with people's jobs also propels inequality, because not everyone can afford to make those installments to have good access to healthcare. So with I think, Christina, with that, we have to switch the teams that discuss second option with different moderators, if I'm correct.
Yes, thank you so much, Faiza. We will be switching now. So I'm just going to give the other group a warning, and then I'll switch everyone. I'll switch the moderators. So everyone else, please just stay in this group, and we'll switch the moderators.
All right. Until we wait for us to be switched, would you like to say, I see that there's a very good point in the chat. Oh, we're here. Hello, Cameron.
We're just in the middle of our discussion. I got very quickly switched. So hopefully Petrovus will join very soon. Hopefully we didn't put you off with conversation as well.
No, we wrapped.
Perfect. Okay, I'm just going to wait for, I can see that Faiza has moved over to the other room, so I'm sure, yes, there Petrovus has joined us as well. So folks, we have about 20 minutes or so to go through the discussion of option 2, which we had some great discussions in the previous group about. But I suppose just to give you a little quick refresher in terms of what we're talking about here today in terms of health equity and what we mean by that. And I suppose we look at things around the cost of healthcare, the access to healthcare, what may push huge burdens or less burdens on healthcare in years to come. We've all just seen over the last number of years COVID-19 and the impact that has on healthcare systems, and maybe pushing healthcare systems to places where maybe they don't operate as efficiently. So option 2 is looking at, well, letting people make their own choices. So in this option, we look at, okay, well, the most important way that we can improve our healthcare system is to actually to bring healthcare prices down. And the best way we think in option 2 to do this is to give the responsibility for making those choices to yourself. That you shouldn't have to pay for coverage that you don't want or don't think you'll need. And that prices should be publicly available, and that by doing that and easy and understandable, that we'd hopefully bring down costs by allowing you to kind of shop around and pick and choose what would work best for yourself. So within that itself, we have a number of questions that we're asking you to consider in option 1 that I'm going to paste into the chat for everyone here so you can see them again around this particular option. But I suppose in the initial stage of the conversation, I'd like you to think about maybe how health equity, and maybe you've already had some discussions on this in the previous group, but how maybe this sort of option or health equity in general might affect you, your friends, your family, your communities. Any initial thoughts you have on option 2 from hearing about it, and then we might dive into these questions here. So I don't know if anyone wants to kick off, or Petrovis, if I've missed anything, please feel free to jump in and to say so as well.
Thank you so much, Cameron. I would say you're on the grip, which is good. So I would just welcome people to give on their ideas on what they think about in relations to their communities. Joseph, I see your hand up. I don't know if that was an old hand or it's a current one. Oh, okay, thank you. So what do you think? This comes down to the floor before we go to our questions. Yes, Conte raised the hand. Yes, you can give your view.
Okay. Can you hear me? I'm having connection issues. Can you hear me?
Yes.
Yes, we can hear you.
Okay. Just to make sure that I understand what you're asking us to do, can I respond like in the context of the questions that are posted in the chat?
Yes, if you feel like you want to answer some of the questions, absolutely.
All right, thank you. I feel like they are quite, they will lead my response. So I'll give again reference to my country, Namibia. And the question that talks about how realistic it is to expect people to shop around for insurance plans for Namibia, absolutely no. Looking at the literacy levels in my country, but even the literate people, I think there has to be like mass education and awareness, like creation for people to even know, because even the literate educated people may not know exactly how to shop for insurance plans that speak to their situation. So I don't think that is very practical for my country. And definitely, I think with my country that has got, for example, like the last question says, is it fair to require healthy people to buy coverage that they don't see a need for? So what is healthy people? What does that entail? Because you can have people with chronic diseases, like non-communicable chronic diseases, that would need regular healthcare, but these are still healthy people. An example is HIV. I mean, that's a common communicable disease. In Southern Africa has the highest global burden, right? So you can have like a healthy HIV positive person. They are healthy, but they would need regular access to care. So for that, I think that like leaving it for people to determine whether they need it or not, and is actually unrealistic, because we need healthcare for different reasons, not just to seek treatment, but also preventative care. I know, for example, some services like, I don't know, like contraceptives, like there are some services that are like preventative based. You don't have to be sick to need the treatment, but it is needed for the well-being of a person. So I think option 2 for me is maybe might work in countries that have higher literacy levels, where people have access to like the internet and resources to help them make an informed decision, where there is like maybe lower unemployment rates, because then people can afford to pay for the insurance that they wish to have. But a country like mine that has got a very high unemployment rate, with about 60% of the population accessing healthcare in a public health setting, this might not really be the best option, because I feel like it just still widens the health inequalities among the Namibian population. Thanks.
Thank you so much for sharing that insight, and it's really interesting to see from every different country's perspective. And you've highlighted some similar points to the previous group that maybe you might think about some questions we asked there in terms of how do we provide information that makes shopping around for insurance or for looking for different doctors more accessible, even if option 2 wasn't what we picked. How do we provide that information in a more accessible way? And how do we provide, one person talked about in schools, could they show you how to, what does health insurance actually mean? What is it that you pay, or what is it that the insurance pays? So some really nice parallels there. But I'm conscious to get the other two that have raised their hands to come in. Bakita, I think you had your hand up first, so we might go to you and then to Maria.
Thank you very much. Thank you very much, Cameroon. I really appreciate. I just wanted to say, I think I'm also, as I said that in the previous option, that I'm very uncomfortable because these are kind of extremes. I'm more coming to the center, trying to find something at the center. And I think one issue that I have about this option is that I think there is an assumption that health seems to be a private matter, or it's made to be seen as a private matter. People can make their choices. And I think there is a level and an extent to where that could potentially be realistic. But I feel like also there should also be a recognition that health is not only a private matter, but it is a public and a communal matter, especially in low-middle income countries, South Africa being part of that, where we're dealing with a lot of communicable and non-communicable diseases. And HIV was one of those, where it's not just about me shopping around and finding what's best for me, but also realizing that there should be something or a system that is open for everyone. So in a more universal health coverage kind of perspective. And I think when structuring our health systems, it's kind of important to think of, in South Africa, we call it Ubuntu, which means you are because I am. So I am healthy because you are healthy, not in a very privatized sense. And I think it's more easier to see it when we see our infrastructure where we contribute in a more communal space and we share that infrastructure. No one pays for their own roads and they use that road. But also I'm very much open to say, I think this option might not be very also useful when it comes to primary health care. I think the other colleagues spoke about accessing contraception, accessing primary healthcare services, like the basic preventative medication or interventions. It might not be as useful. I don't see how we might, allow people to shop around that. But I think perhaps in very highly specialized medical procedures, it does make sense, although it might widen the inequalities, but I think it could make sense. But in a more primary health care, which is an approach that most low-middle income countries are going for, to make sure that there is enough distribution of resources. So I think I'm still very conflicted, but I'm just open to the ideas around how health is perceived. Is it a more private matter, or is it a more communal matter? And I'm more leaning towards realizing that it could be more communal than it is very private. Sure. Thank you.
Thank you very much. I'm smiling at a comment where someone said South Africa and Namibia are twinning. So as I would try to guide the discussion a little further, I would like to make you also understand that however much we are emphasizing here that people should be able to pay for their health care, I would also make you understand that these prices, we are ensuring that the prices of healthcare is made public so that everyone is aware of it, to avoid maybe price hiking or something like that, or whatever comes with it. So as Maria comes on to give her comment, I think she'll have that in mind. Thank you. Maria, you're welcome.
Yeah, thank you. I strongly believe that in order to people to be or to have the capacity and responsibility to decide from themselves about their health, they need to be really they really need to understand the repercussions of their decisions. And to give context, in my country in particular, there's a high rate of illiteracy, analphabetism, which I believe that really compromise their decision-making capacity. So I really agree with those previous speakers. And another situation that I would like to analyze is that how honest insurance will be in a context where the right of health was already private. Yeah, that's the both things that I believe that really don't fit in this option.
Oh, wow. Thank you. Thank you so much for your view. As we proceed further, I would love to bring another interesting view that Joseph has put in the chat. He says that in his view, the option to buy now and pay later future for healthcare might be beneficial for low-income earners. This has its own drawbacks too. Okay, I don't know if you would love to elaborate more on that. And yeah, you furthermore add on saying that I think it's an interesting option, but how do we set time when you should pay later? Or how do you create a transparent and accountable system with this? Really curious idea though. Yes, that's interesting. Would you love to add anything on that? Or would anyone have anything to add on what Joseph has put forward? Or we might dive to the next part of the question as well. Yes, Maria, I see your hands up. I think it's an odd hand. Okay, sure.
Sorry, I don't know. I'm trying to raise my hand up, but it's not working. I don't know if you can hear me.
Yes.
So,
Yes,
okay, yeah. So my name is Tinashe. I'm here representing Zimbabwe. So I want to answer the question where it says, how realistic is it to expect people to shop around for insurance plans? Most insurance clear about what they will offer. Well, in Zimbabwe, there is like high illiteracy also. A lot of people are like not educated about health insurance. So it's like tricky to make them choose and then trying to make them understand. We're talking about someone who lives in the rural areas. All they know is to use maybe herbal plants. They're like, sometimes they're just like, no, we're not gonna take it because it means that we have to contribute some money. So we can't really like expect them to make the right choices. And then also, so that's like my contribution on that part. And also these insurers are not really clear about, what we're gonna get out of it. And then my other contribution is that when we're talking about people who are not sick, should they get health insurance? Well, you'd never know when you're gonna get sick. It can come today. You go to the ER and they're gonna tell you about, you have like this big problem. So I also think that people should get health insurance irregardless of being sick. Irregardless of being sick, you still have to have health insurance, because nobody ever asks, like, today you might have get in a car accident. You never know what's going to happen. So I believe that people should have health insurance irregardless of being sick or not. So yeah, that's my contribution for now.
Thank you so much, Tinashe. And I think you highlighted some very similar thoughts to the other group in terms of that, going back to value for money. How do we create a system where people want to buy in or feel like they can buy in or feel like they have enough understanding to buy into a system like option 2 or even like option 1? So really, really interesting contributions. Thank you so much. Ndeshi, I saw you have your hand up as well. And I know, Joseph, you did have your hand up, and I can see Mercy, that you unmuted as well. So we might go, Mercy, just because you haven't spoken
I'm
yet.
sorry, I'm trying to raise my hand.
That's okay. We'll go to you first, and then in Ndeshi, and then Joseph, if you want to come back in again, please feel free to do so.
Okay, thank you, Cameron. So in my opinion, I'm going to say if insurance companies were really very clear on what they will cover and what they will not cover, a lot of people want to insure. But truth be told, people just sign the insurance forms without really having an informed consent on what they are signing. Like the previous person just said, majority of the citizens in suburbs, for example, may be illiterate. Patient at the insurance to explain and make you understand that this is what you're going to get from our insurance. And some insurance companies want to cover your health, but they don't want to cover some aspects of your health. Some other insurance companies will tell you, you can pay from your pocket and then you bring us the receipts for reimbursement. Why, if I can pay from my pocket, so why am I insuring? I don't think there's a need. So if you cannot pay for me when I need it, then there is no need insuring you. And when you get to some services, for example, in my country, some insurance companies are not covered by all the health facilities. You get to pay before you go with the receipt. So what if you don't have the money? I think if people are not insured, some people will plan and keep money for rainy days, such that if something comes up, which might not cover all what is supposed to cover. So insurance companies should be clearer on what they can cover, such that if you go for that. Thank you.
Thank you so much, Mercy. Folks, we have about 2 minutes or so left before we'll be all pushed back into the main room. So Ndesh, if you want to come in really quickly, and then if anyone else wants to jump some stuff into the chat, please do so. But really, really interesting conversation, folks.
Okay, really quickly, thank you so much for the opportunity. So the buy now, pay later aspect for me would not really work in my country. Number one, we use the cash-based system. So literally, if you miss me at that point to pay for your services, chances are you will never get me again. Because I mean, I'm from Namibia, although I live in the US. And usually the pay later system in the US would ask you to put down like your credit card or whatever that they can charge over time, whatever time period you choose. And then secondly, the challenge I have with the buy now, pay later would be with countries with such high unemployment rates and very unequal economic issues. What would be the end product for people who are unable to pay? Are you gonna arrest them and like what? Are you gonna blacklist them when they can't pay for something such as health, which is a human right? So the buy now, pay later aspect would definitely just not work in my country. Thank you.
Okay, folks, we have 60 seconds. So if anyone wants to jump in, they can, or we can head back to the main room.
Just want to thank everyone for contributing, and thank you so much for an amazing conversation.
Yes, thank you, everyone. It's been really interesting to hear from all the different countries' perspectives and understanding maybe what wouldn't work and what would work, what wouldn't work, and maybe different places in between that we can find common ground, which I think is always a really nice special way to finish a conversation, I think.
Hey guys, welcome to the main room. So every country in the world face a daunting set of challenges trying to reduce healthcare costs while getting needed healthcare in the most accessible and affordable way. It is more important to think carefully about what matters most to us and what kind of decision and action will allow our community and countries to prosper. Some important questions to consider are, what do we agree on? What do we have to talk about more? Who else should we hear from? What else do we need to know? How did it go? Does anyone want to share a reflection, either by chat or by your can take a microphone.
Thank you very much, everyone, for the brilliant discussions, your wonderful point of views. That was amazing. The different group of people that we met and the ideas were very brilliant. And I was so surprised that the two teams that we met, they had very similar ideas, and it was a robust discussion. As we try to wind up, let me welcome Cameroon to wrap up on the side of option 2, and then Faiza can wrap up on the side of option 1. Then we can proceed from there. Thank you.
That sounds good, Petrovus. And maybe we can think of any questions or comments. Before I wrap up on option 2, I think something that I'm particularly interested in is if someone read the issue guide beforehand and was really set on option 1 or option 2, and through your discussions have maybe flipped onto the other option, or if anyone has an idea for option 3, if that's something completely different, completely new, or a little hybrid of both. I'd be really interested to see people's, or to hear, or to read people's perspectives on that. But I think from the option 2 perspective, and Petrovus, please come in at the end of this if I haven't covered everything, or with your own thoughts as well, is that there was a lot of, I suppose, back and forth on who should run health insurance programs, whether it be government or whether it be private sector, and how do we manage accountability and transparency with that. But even at a more fundamental level of, well, how do we ensure equal access or equitable access to those sort of programs or services when we look at literacy rates in different countries, or access to information in different countries, or even just understanding the clarity around what insurance may or may not cover, and how we get that kind of transparency in an accessible and easy to understand way for every folk across our countries that we had discussions around. But also a discussion for value for money. So what am I getting out of this particular system that I'm putting in? And how do I ensure that it is the best option for me? And how do we ensure that as countries and nations? And I think most groups agrees that it shouldn't necessarily just look at the view of, if I'm sick now, I should pay into something now. And if I'm healthy now, I shouldn't pay into something now. And that you don't necessarily know when you may become ill or when you may need some health coverage. And so a system like that can be a little bit, maybe a little bit flawed, or a little bit kind of rudimentary, or not very open or accessible to lots of different types of people across the globe. But Petrovus, is there anything else from your perspective from the discussions we had? Those are some of the notes that I took down.
Thank you very much, Cameroon. Just to add on what you said, in the previous groups, many people were advocating for mass education on making people understand insurance rather. And then one more interesting point was the assumption that health is not only a private matter, but a public and communicable. So it is much more of a community issue, not a private issue. Therefore, the phrase that brought up the issue on Ubuntu, that you are healthy because I'm healthy, that really stood out in our discussion. It was a point that many people were agreeing to. Yes, I think there is from our side, maybe from the option 1, that is Faiza, you could come on and let us know what transpired during that session.
Thank you, Petrovus. We discussed option 1 on both sides and had interesting discussions on both ends. Some patterns I noticed was immediately the first question was, how do we trust the governments to make sure that to trust them is such an important thing as an effective healthcare system. A few people brought up that currently many countries have 2 healthcare options. One is the government issued and the other is from private insurance companies. And even in these existing situations, the government option is usually looked as the worst option, or the option people go for when they have no other choice. That was something that was brought up a few times. Another issue was, how do we hold the government accountable with such a system? with such a system. Someone also brought up in our breakout group too, is that it's not just the government we don't know if we can trust, is also the healthcare providers and insurance companies who often, when they know that the insurance payout is going to be huge, they can take advantage of systems. And we had a few people share their personal stories that that was powerful. Someone even brought up the discussion of democracy and who should be asking these questions and who should be answering such questions and making such decisions. Is it that everyone should come together and come to a final conclusion and consensus, or it should be experts and healthcare providers who should be having the conversation? Another important two more points that we saw was one question was about the capacity of the government and how many health conditions can they cover and ensure that whatever you are going through is covered by them and they can help you treat it. Finally, there was in both groups, there was this direction of, yes, we want universal healthcare and we want to head in that direction, but just unclear on the path to get there. We had some disagreements that the governments can be trusted, and then we also had disagreements that private sector could be trusted. But yeah, those were the major takeaways that I had. Mark was with me. Mark, would you like to add anything?
Thank you, Faiza. I think you literally nailed it on the head. As you were going through what you're saying, I was just like taking off what I had been was gonna mention. I think like just generally like this whole thing as it should have sparked a lot more questions, which is great because that's sort of the outcome. So I think you did a fantastic job of summarizing everything. Thank you so much, Faiza.
Thank you, Mark.
Thank you very much, team, and everyone for joining this discussion. If we do not have any other option or questions, before I close that, I would love to channel this to the audience. Is there any question you have on this issue guide, or is there something you thought you may think we would revise for the future in case of such further discussions, or any other comment that you may give? We have about a few minutes for that. You can give in your views. And I see some people more serious about health being an Ubuntu issue. That's going to be a strong phrase standing out, a strong phrase standing out there. So is there anything anyone would love to add before we officially think of ending the discussion, or any advice you give in?
I have one.
Thank you. Yes, you can go on.
Thank you. I think based on the discussions, perhaps my suggestion is that we continue having conversations about holding our governments accountable, because regardless of what option I think we either lean towards, I think the utterances, at least from most African countries, is that we don't trust the government, and giving them the whole mandate to finance and improve access to healthcare requires us to trust them. And I think in order for anybody to trust you, one needs to accept that comes with some responsibility and accountability. So perhaps further conversations need to be held on how we can hold our governments accountable, because by the way, we are the government, right? These people, we put the people that are leading us in government into power. So what do we do to turn around the issue of mistrust with the people we have given our trust to lead us and make the right decisions that are benefiting us all? So just a call for more conversation about holding governments accountable. Thanks.
Thank you so much. Thank you so much, Kochi. I see Free also making a comment in the chat saying, if government puts systems for monitoring in place, then we will have more people supporting a public health system in Africa. And Aruna is greatly agreeing to that. Thank you so much for your input. Is there any more person before we can welcome the co-owners of the discussion? Yes, finally. Okay. So lastly, Faiza is saying, how can we build trust in government? Always goes back to democracy, which is a threshold of Catering Foundation. Thank you very much, Faiza, for that point. And looks like folks are taking the discussion back in the chat room, which is much more interesting. So as we conclude this discussion, allow me welcome Christina or Lolene. If they have anything to say, then we can officially close. Thank you so much.
Yeah, thank you everyone so much for these conversations. It's been amazing to hear all of your points of view, and love to keep these discussions going. And I encourage everyone to keep an eye on the next few, the activities of the Tower Network going in the future. Subscribe to our newsletter, because a lot of these opportunities, such as the one, the event that we're having today, we'll have more of these, and hopefully we can continue these conversations. So thank you.
Thank you, Christina, and thank you everyone so much. I'm having mixed feelings here, because on the one hand, listening to all of you have this conversation and watching you structure this conversation and moderate this conversation has been very inspiring and makes me very hopeful about the future. And on the other hand, our conversations about corruption and a lack of trust in institutions, particularly governments, for very good reasons, is disheartening and feels kind of heavy to hear on such a consistent basis in so many different places around the world. And so I'm really of sort of two minds on this subject. And I guess, I'm hopeful by nature. And so I think this is just a good opportunity for me to say that this effort has been led by a group of young people who are truly the next generation of leaders. And we have had the good fortune of working together for some time. And there's a tremendous opportunity on the horizon in terms of resources and other possibilities for ongoing collaboration at a much greater global scale. And so for those of you who are not as familiar with the Tower Network or who are newer to this group, I would urge you to stay in touch because, again, we have every reason to believe, without getting too specific here, we have every reason to believe that this excellent work will have the resources to grow and expand its reach and its impact very significantly in years to come. And so we'd love to bring you into our network and join hands and work together with the hope that that we can make some very profound systemic changes in many countries around the world over time. So thank you for your time, and thank you so much for the young leaders who have put this excellent session together. I'm grateful for you personally and also professionally.
Thank you so much, Christina, and the entire team, the Panari team. As you can see, you could also check in the chat room. A lot is going on, and also on our Twitter page and everything. So as we come to the end of the meeting, we look forward to engaging with you further. Thank you very much. Have a great time.
Thank you, everybody. Have a great evening, afternoon, morning, day, wherever you are.
Thanks,
Thank
everyone.
you.
Thanks,
Thank
everyone.
you.
Thanks, everybody. Thank you.
Yeah.
Thank you all.
Thank you, everyone.
Thank you.